Hey, welcome back. Let's talk lasers. Now, there's different types of lasers on the market. There's classes of lasers. All lasers are classified. They're either 1, 2, 3, A and B, or 4. Therapeutic lasers are 3 and 4. Class 3 lasers go up to a half a watt of power, or 500 milliwatts, however you want to say it. Class 4 lasers are over a half a watt and on up. The more wattage, the more power, the deeper the penetration. Class 4 lasers are in a near infrared range, which means you can't see it with your naked eye. Whereas Class 3 lasers are a red light and you can see the red. So we use Class 4, very powerful, so they get deep. Especially on knees, you want to get deep into that cartilage and get past all the other tissue in there to stimulate the healing of the cartilage and the ligaments around the knee. So we use two different types of lasers for that. We have one type of laser, Class 4, has two wavelengths combined together called MLS type laser. So those merge the two wavelengths together. Then we use a really high power laser, one of the most powerful you can get, called a HILT laser, which is high intensity laser therapy. So the HILTs are at a much higher wavelength and they'll go really deep. Has a really good affinity for cartilage, more so than the other laser does. But these kind of do the same thing, but a little different, if that makes sense. So we use the HILT laser as part of our knee program, as well as the MLS laser. Now the MLS laser, I'll show you some pictures of it, that also is used while your knee is getting decompressed. As your knee is being pulled open, we shine the laser beam deep into the tissue there and make some great changes while that's happening. Let me show you our high intensity laser and a little bit about that. So bear with me here. All right. Now, this is it right here. It's a big unit. I'm not going to turn it on because it's noisy because it has a big fan in it. But we have these different laser heads. And these shine out a laser beam. And we put that on the tissue wherever we're treating. That laser goes deep in the tissue and makes those changes. So the changes it makes are really awesome. It creates, like we talked about, stem cell production. So lasers can create stem cells on top of the other modalities we're using. We also create a thing called ATP, which is energy in the cells. So it makes the cells work better and faster so they can heal faster. Increases blood flow. Also creates new blood vessels. And it takes pain out by reducing a thing called cytochrome C oxidase. So it reduces pain. So multiple functions with the laser. Fantastic machine, does a great job, and we've got some of the most powerful lasers that get the job done, and that's what you need. So if you have any questions, give us a call, come by. If you want us to check your knee out, schedule an exam, give our office a call.